How would you like a drunk surgeon operating on you?
Not sure I want one that's not drunk operating on me.
Well, it sounds ridiculous, but orthopedic residents average about 5.5 hours of sleep a night, and that is equivalent to being legally drunk for 25% of the time. And some of these surgeons are really only getting like 3 hours of sleep. So is it any surprise that the risk for errors goes up?
Hardly. There's been a problem forever. And I know back when I was an intern and a resident, we were on for 36 hours and off for 12 for months at a time. And they kept saying, that's what you need for your training so you can be tough, and if there are emergencies that come up, you'll be able to respond.
That's what
no, we don't think you make any more mistakes, but it makes you mentally sharp. And I'm going, what?
That's what you needed to staff the hospital, is what that was about.
Well, it's all about money, because the cost of trying to staff a hospital with doctors that are making a lot of money as opposed to interns and residents is a whole different story.
So what happened to this new schedule, though? They had a new schedule for guidelines, a new guideline for the schedules. What happened to that? Because they were trying to address this problem.
They've been making new schedules for 50 years, Vicki, and they still haven't solved the problem, because they still are trying to get cheap labor out of interns and residents. And now they're saying, well, for first-year residents, that they're going to limit their number of straight hours to 16 hours. But once you're a senior resident in your second, third, fourth, and fifth years, it's okay to work for a lot longer.
For 28 hours.
28-hour shifts. I don't know what they're thinking.
But think about 16 hours. That's 2 shifts.
Right, in a
and
row.
You do that every single day? I mean, no wonder they're not getting enough sleep, and they're not having a social life.
Well, how about 3.5 shifts,
Yeah.
when you're doing 28 hours? Somehow the logic of that is so obvious, and yet nobody wants to take the bull by the horns. Where are the doctors that are in clinical practice or in the house staff coming in and saying, no, this is wrong? Why don't they do that?
Because they had to do it, so the others have to do it.
Well, there's a little of that, but I think they're also thinking about, how do you make a hospital run? How do you pay the bills? How are you going to make this all happen? Because the Institute of Medicine looked at this, and they figured it would cost $1.7 billion just to fix some of it. Now, if you're talking about fixing the whole thing, it's a lot more, but what they're not looking at is quality of life for people who are going through training, and they're not thinking of the patients. I don't want a doctor who's been up for 28 hours operating on me. I want him near me. I don't even want to know him.
Well, and also, do we really need to be spending more money to do these studies? I mean, it seems like it's pretty obvious what the situation is.
It's somebody trying to make it okay. It's not okay. Why don't we just get that through our heads? It's not okay. Doctors are people too, and they need to have a full life. We need to look at everything they need. Yes, indeed, they have to work, and of course they have to work hard, but 28 hours or 36 hours or whatever the hours are that they're working is ridiculous.
Okay, so they're wanting to do this to keep costs down, but at what price?
Sure, because interns and residents have like in the first, even in medical school, they have an 11% incidence of people thinking of suicide. I mean, that's people who are trying to be the healers of tomorrow should be coddled. They should be treated with great dignity and respect.
They're tired of being drunk. They're alcoholics on lack of sleep.
Well, that's right. And those were the tests that were done. They tried to see what their mental function was and equate that to how much alcohol was it. And when you're getting 5.5 hours a night of sleep, it's equivalent to having alcohol level of 0.08, which is a legal limit of being intoxicated.
I was talking to a friend last week who had just had a surgical procedure done, and he said on the other side of the curtain there was another patient, but the patient was a doctor that, I don't know what happened to him. He had an accident or whatever. He needed some surgery, and he heard the nurse say that they could do his surgery like later in the day. And he said that he didn't want to be that doctor's last patient.
That's right.
He said, are you kidding? And he made some big thing about it. And my friend overheard what he said.
Right.
And my friend, so then they came in and they asked my friend if he wanted to have his defibrillator put in at 6 o'clock at night. And he said,
That
no
was
way,
easy,
I don't want to do that, especially after he just listened to the doctor
That's
firsthand saying he didn't want to do that. So,
Well, some things need to change that haven't changed yet. We need to start treating our interns and residents as human beings. They need to have time for their families and time for a little recreation and time for vacation. They shouldn't be working long shifts because it's inhuman to do that. When you finish 6, 8, 10 years of training like that, it's no wonder you come out the way that a lot of doctors do, where they're not so compassionate, they're not so much listening, they're trying to get the job done, and they're trying to do something to make their lives work.
and they probably don't really want to be that way. They just can't help
No.
it. They're tired and they're pressured. And
They started out wonderfully. They were bright-eyed and bushy-tailed, and they wanted to help people get well. They wanted to be healers. So we need to look at this problem and start taking more action that makes sense. We shouldn't have the highest rates of suicide, alcoholism, and drug use amongst physicians. It's just not right. I mean, these are the people that are treating people for that. So we need to take a stand. No more tired residents. Let's treat them like human beings, and maybe what we'll have is doctors that were more willing to listen and to care.